wonderful international colleagues. We're happy to be here with you today as we give an overview, an introduction to integrative and functional nutrition. And here are our disclosures. And our learning objectives, and I'm going to turn off my video now, but it's good to say hello to everyone. And but you'll see me disappear at the top of the screen. Our learning objectives for this session will briefly examine a timeline of the integrative and functional medicine and nutrition movement and describe the principles of integrative and functional medicine and also the key elements of a functional nutrition approach, and also demonstrate how to apply this in practice with using a case study. And I just want to also mention that there's a complete list of references, so any papers that you see noted and such in the slides, and these are, the references are included at the end of the slides. Oops, I got to find that little, there we go. And before we dive in, I just want to briefly share my story and what ignited my passion in this field. I do believe that all our stories matter. And for me, it grew out of a personal health crisis with a complex autoimmune disorder, or I should say disorders, that seriously impacted my life, my quality of life. I was living in England at the time, and it was the mid-1980s. And I was searching for treatments beyond what conventional medicine had to offer me. Fortunately, I came across the work of Dr. Jeffrey Bland, who was a pioneer in nutritional medicine, and his work and others like Dr. Paul Cheney, Dr. Leo Galland, really inspired me to question and investigate how nutrition, of all things, might be playing into my multiple diagnoses. So here I was, an RD with a master's degree in nutrition from an accredited university, and I had to now consider, how was nutrition playing into my chronic illness? What did my diet have to do with my immune system? And was there a connection between my gut and my digestive disturbances and my autoimmune diseases? So I had many, many questions, and the answers did not come overnight. Remember, this was the 1980s. There was no Dr. Google, no Wikipedia, no social media, no patients like me websites. So for me, it was years of investigation and experimentation that required an openness to a new nutritional lens in order to restore my health. So I'm now going to give us, really, I'll call it a swift overview of the origins of the integrative and functional medicine movement dating back to the 80s, when functional medicine, as I mentioned, as you see here, was really known as nutritional medicine for many years, and eventually the name was changed to functional medicine. And around the same time, there was a parallel growth in complementary and alternative medicine, and then in the U.S., a White House commission on CAM, this middle blue bar here that you see, was established. And so there continued to be a strong interest in the field. And in 2014, the National Center for Complementary and Alternative Medicine changed its name to the National Center for Complementary and Integrative Health to really embody a more expansive healthcare, complementary healthcare arena. And then during the past 2 decades, there continued to be significant growth in integrative, functional, and lifestyle medicine with increased consumer demand for these services. So now if we go up to, I think what we're most interested in are the dietetics and nutrition profession in this area. And again, I'll just mention this is a snapshot. It's not intended as a comprehensive overview. But I think important to note that back in 1998, dietitian thought leaders and early adopters of complementary medicine formed the Nutrition and Complementary Care Dietetic Practice Group. And the national CAM movement in the U.S., as you can see, this parallel was really gaining momentum. So these dietetic pioneers were on the cutting edge, recognizing that the solution to the rising healthcare crisis warranted a new lens that still embraced conventional dietetics, but also integrated complementary practices into nutrition care plans to improve patient outcomes. So in 2000, here you see in 2002 and 3, they convened a task force to develop competencies for practitioners, acknowledging that education in this area was necessary to ensure RDs could provide high-quality nutrition services. And then in 2009, recognizing the really explosive growth in integrative and functional medicine, nutrition and complementary care became the dietitians in integrative and functional medicine. And then for the next 2 years, our group worked on publishing standard of practice and standards of professional performance, as you see there, SOP, SOPP, and also the radio, which was really reflecting a framework for integrative and functional nutrition assessment. And I'll illustrate that shortly. I also want to mention that the SOP and SOPP, and we are, I think, the only group that really has these standards in this specialty area, along with the radio, were updated not too long ago. And again, those papers are included in your references for those of you who do want to explore these publications further. And there continues to be a number of articles on complementary medicine use around the globe. This paper, one out of Australia, highlighting its use there. And you'll see the authors note that the prevalence of complementary medicine use in Australia has remained consistently high, demonstrating that complementary medicine is an established part of contemporary health management practices within the general population, and they know it's critical that health policymakers and healthcare providers acknowledge complementary medicine in their attempts to ensure optimal public health, something we're all interested in, and patient outcomes. So it really is another call to action for RDs to upgrade their knowledge, skills, and competencies in this area. And then the World Health Organization published a global report on traditional and complementary medicine, noting it's an important and often, get this, underestimated health resource, especially in the prevention and management of lifestyle-related chronic diseases. And given the unique health challenges of the 21st century, I think which we're all experiencing, traditional and complementary medicine is undergoing a revival. I just love that. It makes you want to certainly join in, doesn't it, in this revival. And interestingly, though, however, this is a reality check for the revival. We surveyed a select group of dietitians practicing integrative and functional nutrition, which included over 5,000 Academy members. And integrative medicine, or IM, as you see here, was the umbrella term that we decided upon that would embody integrative, functional, complementary, and alternative medicine. We had a lot of discussion about the one term to use. And interestingly, what we did find that some of the top conditions seen by RDs in this area were GI, allergies, immune disorders, mental health conditions, chronic pain, and certainly others. And we found that in spite of a strong interest in integrative medicine, there were major gaps in RD's knowledge and that the greater challenge still continues to be that RDs are inadequately trained, along with the lack of mentorship in this area. So what are the common tenets of integrative and functional medicine? It is an evidence-based and evidence-informed, and I think that's really key. The terminology that we use, an evidence-informed, practice-informed, patient-centered approach with a focus on the whole person, body, mind, and spirit in the context of one's culture and community. It is rooted in nutritional systems biology that requires understanding an interplay of genetic, biochemical, microbial, environmental, lifestyle factors to address underlying causes of dysfunction and disease. And as an integrative functional practitioner, we work collaboratively with a patient, guiding them in, as you see there, personalized treatment plans that utilize both conventional and integrative modalities. And this recent paper highlights guiding principles under consideration for personalized nutrition. And personalized nutrition, as we know, refers to individual-specific information founded in evidence-based science to promote behavior change that can result in measurable health benefits. And so personalized nutrition technologies that we need to stay on top of include the various omics approaches that offer potential for us to really hone in and get more specific on the nutrition care that we deliver, because we can then assess molecular level data such as genes or the microbiome, and this helps us again determine a more tailored, personalized course of the nutrition intervention. So how is this defined? How do we define integrative and functional nutrition? Well, we define it as the advanced practice of applying a personalized nutrition care process with the goal of promoting health and preventing diet and lifestyle-related diseases using the principles and concepts of integrative and functional medicine. So I'm just going to review the key elements before we dig into the case study of an integrative and functional nutrition approach, beginning with the infographic, the radial that you see there that illustrates the various areas that in our critical thinking we want to consider in applying this model of care and practice. So I'm going to start with the center of the radial, which you see there, personalized nutrition care. It integrates the ADIME process, nutrition care process, and you see that it embodies, as I mentioned, body, mind, spirit, community, and earth. And like conventional nutrition assessment, we gather the patient's story. You see this blue bubble here of around their diet, lifestyle, and environment. A functional nutrition assessment considers genetics. You see the strands of DNA that we included in the radial, epigenetic, of course, and microbial. This was one of our updates that we made a few years ago. We added these beautiful little microbes. All these influences, along with our nutrition physical findings. Root causes, you see the lightning bolts around the outside of the radial, are investigated, and that may be contributing to imbalances in systems, in physiological systems, and we assess their impact on metabolism through biomarker laboratory analysis. And a metaphor that we think brings this approach to light is an iceberg, as you see here. So a patient may come to you with a diagnosis. Perhaps it's type 2 diabetes or chronic kidney disease, or as you see here in the case that we're going to explore, multiple diagnoses. In fact, one survey indicated that a functional medicine patient typically has 6 or more diagnoses. And as you see here, this patient has been diagnosed with fibromyalgia, which was the chief concern, but other conditions, and again, we'll examine this case shortly. And so using critical thinking, we need to consider here, what is lying beneath these diagnoses? Imbalances that should be explored and remediated. Disturbances in a condition like fibromyalgia, disturbances in mitochondrial function, energy metabolism, digestive and microbial imbalances, hormonal dysfunction, oxidative stress, right? And inflammation and immune dysregulation and more. So we have to really think about, and you'll see, you can barely see that I've connected all of these. And we really want to think about what are the metabolic fault lines in these diagnoses. And here you see the acronym that we think brings it to light, and that is STAIN, which reminds us to consider root causes, right? Root cause analysis. The S in STAIN referring to stress. That can be physical, emotional, mental stressors. T, toxins. And when we think about toxins, sometimes the first thing that may come to mind is an environmental toxin. It might be a pollutant, a pesticide. It might be a mycotoxin. But equally important, and especially important, are metabolic endotoxins produced from imbalances in the gut microbiome ecosystem. So we don't want to forget about that when we think toxins, both internal and external. And then the A in STAIN refers to adverse food reactions. How might food allergies or intolerances, things like histamine, FODMAPs, gluten, be impacting our patient? And I for infections, both acute and chronic, especially chronic, such as, take for example, a patient's history of gastroenteritis, tick-borne infections. We're seeing more and more vector-borne infections around the globe. And of course, viral infections and others. And then, of course, the N in STAIN, nutritional imbalances. It might be fatty acids. It might be a vitamin or mineral insufficiencies or deficiencies. So Sheila and I feel if you take one major clinical pearl away from this presentation when assessing the next patient that comes to you, we hope you'll think about STAIN. Think about those lightning bolts on the outside of the radial, and how might these be impacting your patient's health. I think we are all in agreement that the gut-brain microbiome axis is one of the most fascinating and important areas of research today. Learning how to implement a 5R program of digestive healing, as you see here, remove food triggers or toxins, replace with digestive factors, repair with gut healing nutraceuticals, things like perhaps glutamine or other repair nutrients, repopulating with pro, or symbiotics, and of course rebalancing, helping to rebalance one's lifestyle. So learning how to implement and guide a patient on a 5R program will ultimately impact the gut immune system. It will impact neurotransmitter functions and much more. And it's beyond the scope of this presentation, but I do want to say that in my 30 plus, it's really close to 40 years plus as a dietitian, I can attest to its value in improving one's physical and mental health. And not surprising is this paper, which has just been published with new findings that the composition of the gut microbiota in patients with COVID-19 is concordant with disease severity and magnitude of several inflammatory cytokines and other markers of tissue damage. And this was a small study, I want to state that, in which they evaluated stool samples in 27 of 100 patients up to 30 days after clearance of the COVID-19 virus. And I think we've all been hearing reports of long haulers, as they refer to them, patients who continue to have symptoms, especially neurological ones, after the COVID virus clears. And this paper's findings suggest that the dysbiotic gut, dysbiosis referring to an imbalance in the gut microbial ecosystem, the dysbiotic gut that persists after clearance of the virus could be a factor in developing persisting symptoms and or multi-system inflammation syndrome. So remember, I'll show it again in a second, the authors pose the possibility of bolstering beneficial gut species as a novel avenue to mitigate serious disease. And so this is what I wanted to go back to our iceberg. So no matter what the diagnosis, and in one of the clinics that I work at, when a patient comes in with a diagnosis, or most often multiple diagnoses, it's almost like we set it aside and we begin to employ critical thinking here, trying to identify system imbalances such as inflammation, immune dysfunction, dysbiosis, oxidative stress, all of these, fortunately, amenable to nutrition intervention. So another key element of integrative and functional nutrition is using a food as medicine approach with our patients. And we investigate the possibility, remember the A in stain, that adverse food reactions could be causing, they really could be at the root of dysfunction and distress. So implementing a therapeutic elimination diet, for example, a 6-food elimination diet plan, which we're going to share with you, for a patient with eosinophilic esophagitis, or an autoimmune diet protocol is, in my opinion, it's really where we as dietitians should and need to be the clinical gatekeepers. However, it's also an area where more extensive training is needed to sharpen our skills and expand our competencies. Understanding how to interpret conventional labs, for example, a comprehensive metabolic profile, a CBC, a complete blood count and differential through a functional lens, and likewise understanding functional labs such as organic acids, a comprehensive digestive stool analysis, and other functional labs is another key element of this approach. Remember those bubbles on the radio that I showed you earlier, the biomarkers. And there's one critical question that I ask every dietetic student that I mentor, and that is this: have you taken a genetics course? And I have not yet had one student respond that they have had a genetics course. So I advise them, I actually plead with them to take genetics, even if it's as an elective in their senior year. Remember the DNA strands on the radio? Well, nutrigenetic testing, as we know, I think we're all aware, is widely available now, and we, again, need to know how to interpret nutrigenetic test results and interpret it in the context of the patient's clinical story, their medical history, and of course, their clinical presentation. Using dietary supplements responsibly is another key element of an integrative and functional nutrition approach. And this was also an area, going back to that integrative medicine survey that we conducted, that dietitians noted they do not have enough training in. So consider the recent articles, and I'm just showing you, 3 of the many that have been published on dietary supplements exploring this topic to prevent and treat COVID. And why? Because of their potential immunomodulatory, antioxidative, and antimicrobial properties. And I'm sure that many of us have had patients seeking our advice on what supplements to take to stay well during this pandemic. So these are really excellent articles. Again, the references are included. Some really, really deep, good reading there. And finally, knowledge in mind-body practices, mindfulness-based therapies, meditative movement therapies such as yoga and qigong, guided imagery, and others. It's such an important element of an integrative and functional nutrition approach. For me, it really is at the heart of our clinical care that supports our patients' lifestyle in body, mind, and spirit. So with that ringing, I apologize, thought my phone was off. I'm going to turn it over to Sheila, and let's now apply this in practice with our patient who had fibromyalgia. And so Sheila, please take it from here.
All right. Well, welcome everyone, and thank you for joining us. I'm going to go ahead and pick it up here with our case. All right. All right, so what I'm going to show you today is not really a complete and comprehensive functional nutrition workup, but it is a snapshot of how you might get started using a functional nutrition approach. So in this case, our patient was a 50-year-old woman named Felicia. And Felicia presented with a variety of concerns, as you can see here, but her chief concern was fibromyalgia. So we know that fibromyalgia is a clinical entity characterized by the combination of widespread pain and other symptoms, including fatigue, anxiety, sleep problems, cognitive, and GI disturbances. So while there's ongoing controversy over the definition and diagnostic criteria of fibromyalgia, we know that there seems to be a genetic predisposition triggered by environmental factors which continue to be investigated. But ultimately, fibromyalgia is an impaired stress response system, leads to the dysregulation of the nociceptive system and the appearance of clinical symptoms. All right, so let's see. So in this particular case, before you get started, you may already have, if you're in private practice, some kind of an assessment form. And in this case, what you're seeing here is just a snippet of an assessment form, the component called the readiness assessment, where you assess their readiness to change. And where they are in terms of their readiness to change, what their financial resources are, how motivated they are to incorporate your recommendations, all of these things are going to be important to assess. On this slide, you can see the questions here where the patient has an opportunity to evaluate how willing they are to significantly modify the diet, to keep a record of everything they ate that day, to modify their lifestyle, engage in regular exercise, take nutritional supplements, practice a daily relaxation technique, have periodic lab tests. I found personally when I was in private practice, but this was an extremely important component of the assessment. It gave me an opportunity to know how aggressive I needed to get with the patient in terms of my recommendations. And so, the science of functional medicine is what we learn in our training, but the art of functional medicine, functional nutrition, really comes with time and experience, and even making mistakes. So with the plethora of research coming out in personalized medicine, we see that, this one-size-fits-all approach is out, and the integrative and functional nutrition or lifestyle medicine now is in. And to manage the complexity that's inherent in this approach, a good place to start a simple approach, which is kind of like that. You can think of it as sort of like the hammer of your toolkit, is just that simply ask the questions: what does this person need or require to improve function in order to support health and healing? Right? So what do they need? For example, what kind of healing food plan? Do they need stress management? Do you need to address their sleep issues, restore sleep? Obviously, their dietary supplements, movement therapy, diet, and even love. And what does this person need to remove in order to improve function to support their health and healing? And that's where you can think of the acronym STAIN that Kathie just went over with you, and you can assess each one of those areas, whether you're using labs to assess that or whatever method you're using, but it's a great way to break that down. So again, what needs to come in and what needs to come out to create the balance? And as you see here, this is the IFNA Nutrition Care Plan process. It's just a model of how you can go about working up the patient. And what you're seeing here is a funnel-like illustration that starts with crafting together an assessment that includes an expanded dietary analysis and, of course, identifying those STAIN root causes, identifying system imbalances, and then ultimately assessing all of that data while keeping in mind your patient's unique genetic needs in the backdrop, which is why an understanding, as Kathie said, of genetics or nutrigenetics, nutrigenomics is so important, right? All of it ultimately to come up with your nutrition care plan. And so we start with the food component, right, obviously at the top of the list. And of course, this is going to be based on a variety of different findings, including your nutrition assessment findings. And so you might want to start initially with an anti-inflammatory whole foods plant-based meal plan, where you are thinking you're working on removing any offending food chemicals such as MSG or aspartame. And you might add some detoxification supportive foods, organic greens, some herbs, some spices. In this, it's a little small, but in this abstract, you can see that the authors write that with regard to dietary interventions, the administration of olive oil, the replacement diet with ancient grains, low-calorie diets, the low FODMAPs diet, the gluten-free diet, the MSG and aspartame-free diet, vegetarian diet, as well as the Mediterranean diet, all appear to be effective in reducing fibromyalgia symptoms. These results may suggest that weight loss, together with the psychosomatic component of the disease, should be taken into account. And so, you certainly could then move on to a phase 2 or whatever you want to call it, and that will be totally up to you. And as far as when you might do that, again, that's just going to be something that you assess along with your patient. It might be after a couple of weeks, it might be after 30 days. You're going to know when working your patient when you might, when you may need to take it to the next level. And this is the supplements component, where you ask yourself the question, is the patient open to taking the dietary supplements? And of course, that goes back to the readiness assessment, right, where you can go back and use that as a way to give yourself an idea of how open the patient is. And then obviously in the consult, speaking with your patient, talking to them, sometimes what they write in their readiness assessment, I noticed, wasn't always exactly how they felt about it once they got into the consult with me. But it's definitely a great place to start. And you might want to, if the patient's already taking dietary supplements, obviously you want to evaluate that. You want to evaluate what they might need to keep, what you look at and say, okay, this is good, what might need to go, what you might feel, and where you might want to make changes. You're going to want to, take some time to assess that. And of course, asking the patient or understanding if they're taking any medication to assess any kind of interactions. And then based on the patient's clinical presentation, symptomology, and lab findings, prioritizing your dietary supplement recommendations. And that is also very much an art, because a lot of that will also depend on how your patient feels about all of that. So you can have a whole list of dietary supplements, but that doesn't necessarily mean that you're going to want to recommend them all at one time. You're going to get a feel of how the patient's feeling about all that, and ultimately it really will come down to a combination of how you and the patient feels about it, because, obviously we want to promote as much patient compliance as possible. So, I'm sure, you guys are familiar with the idea that even if you have 3 really important supplements you want them to take, if they're only ready and willing to take one, then that's what you start with. Here you see a systematic review offering a feasible means for synthesizing the evidence specific to herbs and dietary supplements on fibromyalgia, which may reveal new and novel research directions, as well as advancing current management approaches to the treatment of fibromyalgia. And the next thing to think about are labs. And I know this is an area that's kind of confusing for dietitians, because dietitians are not necessarily always authorized to order labs. And it's going to vary from state to state. It's going to vary in the U.S., and it's going to vary obviously from country to country. But ultimately, whether you're ordering the labs or you're working with a clinician that's ordering the labs, we still think it's a good idea to think about what kind of labs might be important to help understand the root causes with the patient. So in this particular case with Felicia, some of the conventional labs that you might think about is a CMP and a CBC with a differential, where you interpret those numbers with a functional lens. So you have the standard reference interval, but then there's also the optimal ranges that you might want to take into consideration. So in this case, some additional biomarkers to take into consideration: a CRP, a Z rate, definitely a vitamin D, red blood cell magnesium, a serum homocysteine, and then once again, going back to genetic testing, if you are able to order, or the clinician you're working with is ordering, you can certainly order an MTHFR, which, as most of you already know, stands for methyl tetrahydrofolate reductase. And then in terms of functional labs, some of you may already be familiar with organic acids testing. An organic acids panel is really simply put a view into the body's cellular metabolic processes, right? So organic acids are metabolic intermediates. You may remember back in the day when we took biochemistry class and we were learning about things like the Krebs cycle, and those intermediates that we learned about are actually organic acids. So that's what we mean when we say metabolic intermediates. And they're produced in pathways of, as I just mentioned, central energy production. So again, even the Krebs cycle, but also detoxification, neurotransmitter breakdown, and even intestinal microbial activity. So when you have marked accumulation of certain or specific organic acids that's detected in the urine, they spill into the urine when the pathway can't go through because of a vitamin deficiency. An organic acid can build up, spills into the urine, and that can be measured with incredible precision. And it typically signals a metabolic inhibition or a block. And of course, as I said, this block could be due to a nutrient deficiency. It could be an inherited enzyme deficit. It could be a toxic buildup. It could be a drug-induced nutrient depletion. Now, the labs that get ordered, again, as we mentioned with dietary supplements, are going to have to be prioritized. Some of these are going to be covered under insurance and some of them maybe not. So we do need to take into account fiscal responsibility, and ultimately that typically comes down to the patient, right? There are many companies, many lab companies to choose from, but again, you want to prioritize through. So in this case, with Felicia, on the top of my list is definitely the organic acids panel. There is a proprietary panel called the metabolomics that looks at nutrients and amino acids and organic acids, but it doesn't have to be from any one particular company. And then depending on how aggressive you're willing to get and how open the patient is willing to be, you might want to also order an additional stool test, because remember, this patient presented with IBS, and it would be even better if we can order an adrenal stress index to see what's going on with their cortisol and DHEA levels. All right. So, all right, moving on then to lifestyle, right? And this is an area where you as a nutrition professional can explore with your patient, but also keep in mind that you can certainly refer out, right? Because we can't be everything to everyone. But there's a wonderful menu of options to explore to find the practices that are best suited to the patient, such as relaxation therapies, aqua therapy, yoga, guided imagery, affirmations, mindfulness, prayer, meditation. I mean, there's a wonderful list, and here are some papers on the screen here that address the efficacy of some of these practices with respect to fibromyalgia. And there are many other resources, including mobile apps. And when I was first learning about this, I was really just delighted to learn how many mobile apps there are for chronic pain. I mean, everything from Manage My Pain, Migraine Buddy, Ouchie, Pain Tracker Diary, Flare Down. There's all sorts of mobile apps. And then here you see on the screen a list of a variety of fibromyalgia and pain organizations and support groups, and of course, some referrals, acupuncture, cognitive behavioral therapy, chiropractic manipulation if necessary. There's PT. There's a lot of different areas that you can explore. So again, as I said, this is certainly not an extremely comprehensive case study, but hopefully it gives you an idea of how you might go about breaking down your thought process to, as I said earlier, an inherently complex scenario. And as Kathie said, oftentimes the patient is presenting with up to 6 different diagnoses, right? So in summary, the IFN, or Integrative and Functional Nutrition Care process, incorporates or utilizes an IFN approach to nutrition assessment. It seeks to identify root causes, and we gave you an acronym to sort of start the process about thinking about that. Applies critical thinking to understand system imbalances. And I find that that's especially important when a patient comes in and, it's you may have some protocols, but you might find that you have to modify these protocols based on how the patient, what the patient is saying in their readiness assessment, and the things that they say right there in the consult that lead you to believe, we might want to pivot here and go in a slightly different direction. And that's all part of the art of the IFN care process. And that leads to my very next point, which is designing a personalized nutrition care plan to promote optimal health, healing, resilience, right? Resilience and well-being. And then finally, collaborating with other conventional and integrative functional nutrition, medicine, healthcare providers. So you might be familiar with Dr. Jeffrey Bland, who's really considered the pioneer or the father of functional medicine, and he's been quoted to say that the 21st century has already demonstrated itself to be an era of change for medicine and science. There is a new openness to ideas, to a shift in perspective, to a redefinition of evidence, and the many ways it can be gathered. And I think that for me, that's what's really powerful, the variety of ways in which evidence is gathered. And it's a fertile time, right? Fertile times ahead on many fronts, including an expanded reach for a systems biology formalism and the functional medicine movement. And for me, I just find that to be really exciting as a functional medicine nutritionist to really be at the forefront of this. And so why get integrative and functional nutrition trained? I think what you'll find with time and training is that you'll start to feel an incredible sense of personal satisfaction, revitalizing your career, rediscovering your passion, acquiring knowledge, the skills, the tools in integrative and functional nutrition, truly making you one of the most sought after nutrition professionals in a very swiftly growing competitive marketplace, really becoming that nutrition sleuth, right? And learning how to identify those root causes and those system imbalances and chronic diseases. And for me personally, I can tell you in my practice, I saw an immediate increase in my patient volume and income. And I also wanted to make you aware of a survey that was conducted a few years ago now, which over 7,000 functional medicine clinicians were surveyed. And in the end, 1,016 of them responded, which is still a pretty decent sample size. And amongst their findings was a very interesting statistic that for non-physicians, advanced IFN training equated to a 33% income boost, which I think really demonstrates that this approach is not only changing the landscape of healthcare, but it's also being driven by consumer demand. And so, friends, here are the references that Kathie was referring to that we've put together for you, and you can look at that, and there they are continued. And so just as a token of our appreciation, we just wanted to thank you. You're welcome to go to our website and download the free e-gift. It's basically a 6-food elimination diet that includes a 7-day plan plus references and resources. So with that, thank you, everyone. And thank you for your time. And we're here for another 10 minutes for some questions.
Great, thank you so much. We did have several questions come into the chat box. So if you don't mind, I'll go ahead and relay those to you guys, and then you can take over with the answering. So the first question that came in was for Kathie, and it says, you said that a paper said that dietary supplements can prevent and treat COVID-19. Can you clarify this and also give a brief explanation?
Sure, and thank you for asking that question. As far as clarification, on the slide I showed 3 of many papers that continue to explore the potential of vitamins and minerals and herbals, as you see there, herbal immune boosters, substantial warriors of pandemic. So I've just kind of cut to the chase. There are no, that I'm aware of, published clinical trials due to the novelty of the SARS-CoV-2 virus. But what many of these papers explore, like the one, could vitamins help in the fight against COVID-19, they reviewed a number of studies. I think they started off with, I think they ended up with over 200 studies that they looked at, and looked at the mechanisms, the potential mechanisms, the antiviral, the immunomodulatory mechanisms of various, nutrients. And so I think the key takeaway here is potential with prevention, and possibly at some point in the future, we will have clinical trials that kind of elucidate this. I know one thing that is, that they think is the nutrients may actually help shift the Th17 inflammatory response. So definitely more to learn, but I'm finding that it seems like on a daily basis, this certainly is in the news. And I think for us as dietitians to really stay on top of this and the potential of some of the key ones that are being studied. Obviously, vitamin D, vitamin A, E, C, zinc, and the list goes on. And, you know, with this in mind, I'll just say that for me, and I've mentioned this before in summits that I've been involved in, I think that I wish it was standard of practice that every patient had a nutritional profile done, because I really do believe that by identifying insufficiencies or deficiencies, that it would be a key step in prevention.
Yeah, thank you, Kathie. I just want to add to that very quickly that, you know, for me, I think of this as it's not so much the vitamins or the nutrients specifically that are doing anything. It's how they interact with your body and improving your resilience, right? Isn't that a word that we used earlier, your resilience, and really strengthening your immune system? Because ultimately, I think what we're learning is that the virus, ultimately the symptoms have a lot to do with how your body, your immune system interacts with that virus. And that's going to be based on the resilience of one's immune system, along with genetic predisposition and a variety of other factors. So I think, right, it's not the vitamin in and of itself, it's your body's response to the virus, and that response in part is dependent upon your nutritional status.
Thank you. The next question for anybody who wants to take it is, how often do you typically check in on patients when using this approach?
Well, that's a great question, and that was very much for me. I was in private practice for 17 years, and that was very much a very individual scenario, because in some cases I felt like the patient needed to come back after 3 weeks for a follow-up, and in other cases, depending on the scenario, it might have been a little longer, sometimes even a week later. And now with telehealth, you can probably check in even more quickly. The other thing is, if you're working with a group, I mean, if you're a solo practitioner, you're kind of on your own and you're doing all of that on your own. But if you're with a group, like at one point, I actually contracted with a health coach that did some of the lower level follow-ups for me, so that I was the one coming up with the MNT, the Medical Nutrition Therapy Meal Plan, and recommending the supplements. But some of the follow-up might have been just things like checking in with the food plan, or maybe going into helping them with some shopping. So that I don't have an exact answer for you as far as my approach, because that really is very individualized.
Yeah, I would agree. It's very individualized. I mean, with some patients that I've seen, I will set up an appointment sometimes the following week at the clinic that I've been associated with. We do have kind of standard protocols after their initial assessment, and the initial assessment includes a visit with a physician and a dietitian. And typically the dietitian follows in like 2 weeks. And we're gathering even more of the labs if we've ordered labs, and then they'll follow up with the doctor. So it really does, as Sheila mentioned, vary.
Thank you. Again, a question for whoever wants to take it, but I am an RDN and I'm living in Italy. What is the best way for me to get IFN training?
Well, I hope it's all right to mention, since it's a question, so we'll answer the question. Well, obviously the IFNA, or the Integrative and Functional Nutrition Academy, is an international program. We have many, many international students all over Canada, Australia, Europe. And so, you know, if you might want to check out the website, and if you have any questions about it, you're welcome to reach out, but it's ifnacademy.com. it's 100% online. So
Right.
you know, you're not bound by it geographically, and it's self-paced to help with time zones and that sort of thing.
Mm-hmm.
Thank you. Could you please share Felicia's outcome? Did she improve? What helped?
Yeah, absolutely. Let me go back. Hang on one second. Let me just go over here. So yeah, in a situation like this, what ended up happening was the organic acids, I mean, on this screen, you know, these are the potential labs that could be run. The organic acids panel was the one that really ended up giving us the most information, because it helped us to, because of all the different organic acids and biomarkers that are on that panel, which is, well, that's a subject for another day. But when I got that information, I was really able to personalize my recommendations, especially for supplements, as to, okay, so here's the things, here are the nutrients, the specific nutrients that Felicia is going to need to experience some restoration, to experience a rebalancing, right? So that was really helpful. And one of the supplements that ended up being extremely helpful in her case was actually CoQ10. I didn't mention it specifically, or let's see, let me go up here. I may have. CoQ10 ended up being one of the most important, in high doses of, by the way, ended up being one of the most important nutrients. The B vitamins, which are so critical. I mean, think about it. When you go back and think about your biochemistry, and you're thinking about the organic acids and the Krebs cycle, think about what nutrients are driving those organic acids. They're B vitamins. And so in fibromyalgia cases, B complex, which is a fairly inexpensive and a high safety profile kind of supplement to recommend. And so I recommended, methylated B vitamins for the most part. Now, not really massive high doses. I don't like to go nuts with the dosing, but the B vitamins, the organic, the CoQ10. But equally important, folks, was not just what went into her diet, but what came out of her diet, right? So going back here, removing that, you see that bullet there, removing offending food chemicals. And in this first situation, a whole foods plant-based diet that was also gluten-free. And in this situation, we made it dairy-free. I will say we started off with the gluten-free for a month, and we didn't run the labs until, what ended up happening was, specifically with Felicia, was that we did the meal plan. We did the whole foods plant-based gluten-free meal plan for a month. I think Felicia just kind of wanted to see, even though in her assessment she was open to labs, but we just decided, she really just decided, look, let me just try this for a month, and let me come back and let me just tell you what happened. And when she came back in a month, she definitely felt better, but at that point she was much more ready to fine-tune the approach, and she consented to running the organic acids panel, in which then I was really able to see, look what's going on. I can see the exact impaired pathways. And then I was able to give her more support with more targeted dietary supplement recommendations, you see. Now, in another situation, a patient might be ready to do it all at once, and that happens sometimes, but sometimes you do have to take a step-by-step situation, or a step-by-step approach. And in Felicia's case, that's what ended up happening, and she definitely felt better. Now, it wasn't a situation where Felicia was cured, but let's just say we were able at the end of it to say, bye-bye, Felicia. No pun intended. So that's what happened.